Good afternoon. Good afternoon to all of our colleagues from around the country, members of the National Association of Black County Officials and the National Organization of Black County Officials. I am Roy Charles Brooks, County Commissioner from Tarrant County, Texas, and I am the chairman of the board of the National Organization of Black County Officials. Why an association and an organization? Glad you asked. The National Association is a membership organization. It is empowered to lobby Congress and others regarding legislative matters and other things political. The National Organization of Black County Officials is a 501c3 organization. We do not lobby. We exist to do business on behalf of both organizations to help fund our activities and to provide services to the federal government and our private sector partners so that we can make the deal work. That is the difference. I'm the chairman of the board of NOBCO, and Commissioner Rodney Ellis is the president of NABCO. I will now kick it to my friend and colleague, Commissioner Rodney Ellis.
Thank you so very much, Commissioner, and thank you for your leadership on so many issues, including your time as the head of the National Association of County Officials. And you have mentored me for many years. I am Rodney Ellis, and I'm the president of our association side and vice chair of the board of NABCO. I'm from Harris County. Don't confuse that with our friends in Pennsylvania. I'm in Texas. So is Roy in Texas. And we now know about winter storms, not just the heat and not just the rain. I want to say to all of you how appreciative we are at NABCO and NABCO that you would join us. This is being live streamed. We're glad to have our leadership of the National Association of County Officials, a host of important people. Many of them you see on the screen. It's going to be a great day, and I'm a recovering state legislator. And Roy Charles Brooks reminds me all the time, Rodney, you're no longer a state senator. So I've been tasked with keeping us on schedule. There will be no filibusters today. We have a packed agenda. We're going to get through it. So welcome. I'm glad all of you are doing well. I hope if some of you ended up with COVID, that there are no lingering effects, but we love all of you. Thank you for being with us. And with that, Helen, I think we turn to our presentations.
No, we have to hear from our esteemed
Matt Chase, of course,
executive director of NABCO, my dear friend and a dear friend of both our organizations, Mr. Matt Chase, NABCO's executive director. Thank you.
I noticed he's in the office, by the way. So are we, by the way, in separate offices. He's lived in that place. Every time I catch him on a Zoom, he's in the office.
Commissioner, just don't, you sound like my wife. Not that I should be home. So anyways, commissioners and everybody, thank you. How many minutes do you want me to do here? 5 minutes max? 3 minutes?
Go for it.
Okay. One, I did notice that Commissioner Marianne Borgeson, our immediate past president for NABCO, was just on the Zoom. I think she just jumped off, but hopefully she'll jump back on. Marianne broke her foot and she's trying to get around. She's a little slower than she used to be. But anyways, Brian Namey, our Chief Public Affairs Officer, is on. So thank you for the opportunity.
Hi, Brian.
Just real quick, a couple of notes. Obviously, we're knee deep in the American Rescue Plan, which was the $1.9 trillion plan that just got signed into law for county governments. I think you all are aware we secured $65.1 billion in direct funding that will be based on population. We actually had our first meeting with U.S. Treasury this morning to start talking about the rules and guidelines. We submitted a memo to them that cataloged about 250 questions that county leaders have already come up with. And so it was a really positive, productive meeting. They are on a listening tour for the next 2 weeks, and then they hope to get guidance out very quickly after that. And under the law, you should get your first tranche of money, the first 50% of your county allocation within 60 days. The second 50% would be a year later. But again, it's a significant amount of money, whether you're urban, rural, or suburban. Also, the Treasury Department has another $25 billion for rental assistance on top of what they had back in December. And those of you that represent counties 200,000 and above are eligible for a direct allocation for that rental assistance as well. A lot of other pieces in the American Rescue Plan that touches counties. We have a lot of different materials. I can wait for Q&A if you want to talk through it. But you know what we're really encouraging the members is to think how you invest this money, not just spend it, that it's a once in a generation opportunity. Congress will probably be broke by the time we get through COVID. So, you know, this might be the last bite at the apple for a while on some of these big initiatives. Although President Biden is going to unveil a major infrastructure package next week.
Oh, it is.
And I do think that Commissioner Brooks got to him because in his definition of infrastructure is human infrastructure. Yes. And he is proposing a $3 to $4 trillion package with about $1 trillion dedicated to human infrastructure. So, you know, I'll wait for more Q&A. At this time, but one last thing I did want to mention is our board of directors voted a couple of weeks ago to have our annual conference in person, or a hybrid at least, with both in-person and virtual opportunities. It'll be July 9th through the 12th in Prince George's County, Maryland, right outside of DC. So we're very appreciative of both the county executive and the county council for working with us. Thank you to Derek Albert, who helped me find a cell number that I needed, as usual. And so, you know, we're excited about that. Brian Namey is going to lead the planning for that, but we are looking forward to this hybrid event. And then lastly, I just actually jumped off a board call with the Bloomberg Foundation's Equity Intelligence Platform. It's a new kind of equity data platform. And to Commissioner Ellis, Harris County is one of the 2 counties featured with Allegheny County, Pennsylvania. And what is interesting about this conversation on equity is all of these different entities that have worked with city governments for years have discovered that the health and human service portfolio, along with criminal justice, sits at the county, and that they kept running into roadblocks that the counties owned all the data. And congratulations to the Harris County Fiscal Court for creating that new Office of Equity that really has a policy, a data lens, and really looking at DEI as you develop your county policies, that you really are at the forefront of this movement nationally. So let me just stop there and see if there's any questions or any comments or any other things that we can cover. Appreciate the partnership with NOBCO and NABCO.
Bless you, Tony.
Rodney, now you're muted. Helen told me
we're trying to come up. I'm sorry. Yeah, we're trying to come up with some equity principles on how we spend this money before my colleagues and I, shall we say, get our hands on it. Because once it starts, it's hard to stop. And I spoke to Los Angeles County, and I was told that they have come up with some guidelines. So you might, and even during this call, if you have to leave, for all of us, drop something in the chat box so you can comment on it. And I'm just thinking before we do it, we did that with our flood bond package. And I've talked to you about trying to change that federal formula where cost benefit ratio means whether you have earthquakes in California, storm in Houston, everything's happening in Fort Worth now, wherever, Tony, your part of the world, don't value property over people. Obviously, we all want to protect our downtown, our courthouse, our medical center, our ports. But something's wrong when you go protect the neighborhood I live in now over the neighborhood I came out of. Something's wrong with that. But any thoughts on equity guidelines before we, because my colleagues and I already, everybody's chomping at the bit to start spending the money before it gets here.
Yeah, I think that is probably the top of mind conversation. How can you separate the race discussion with COVID, where the communities that have been hit hardest by COVID happen to be Black and brown? And the American Rescue Plan is the American Rescue Plan to recover from COVID. And that's not just the public health consequence, it's the economic consequence that minority communities both contracted the disease and either died or were incredibly sick from it, and also lost their job for the most part, depending on the basis of their economy. And so we are seeing counties put a lot of effort into equity. I would say the lessons learned from the CARES Act and the what we call the CRF dollars, the previous Treasury dollars, is that there were certainly counties, Cook County did a really good job around looking at this, particularly as they suballocated money to smaller municipalities. They put a racial equity lens over that suballocation. Los Angeles, as you mentioned, but King County out in Washington did some good work. Our team, would love to hear from all of you. I know Mecklenburg has done a ton of work around this conversation. And so tell us what you're doing and we'll work with Helen to share it. And we have a whole team at NACO that we're hiring up. We're hiring about 8 grad students to actually track all of this and to figure out how we scale it and get it out to you in useful information. And we're also starting a network of the new DEI coordinators that counties are hiring. And we're finding that counties are hiring chief equity officers, both for counties as employers and for your own workforce, but also chief equity officers to deal, like Rodney, when you're commissioner in your case, the policy lens that the fiscal court when you adopt your resolutions. So we're trying to put together these networks of those working on the county policy and those working on counties as employers, because we do employ 1% of all Americans work for county government. If we change our behavior, we can really lead. So not sure if that helped you or not, but
It's very helpful.
It's top of mind.
Thank you. Very helpful. Any other colleagues? Tony, I saw Commissioner Tony Carter, President Tony
Well,
Carter.
she's mentored me, so if I answered wrong, it's her
Thank
fault.
you.
She's taught me everything.
Not really,
Chair,
but I have just put in the chat a few comments. I didn't have a link to put in there today because we have just completed an assessment of our CARES funding allocations. Early on during COVID, we put an equity action circle in place. We do have health and equity administrators in Ramsey County who serve our major work groups, groupings of departments collaborating together and across those work teams. The Equity Action Circle was a group of people from our community who worked with those equity administrators. And again, early on in COVID, came together, were there during the George Floyd incident, of course, here in the Twin Cities area as well, to make certain that we were able to use their expertise and advice to direct the funds from CARES and also to respond to the social injustice and the uprisings after George Floyd. I'm thrilled that we have the report. I just got it this morning, but would be very happy to share it. I'm certain we'll post a link and we'll be in touch with Helen as well. Thank you.
Thank you. Thank you so much. Maybe 1 or 2 more questions while we have Matt. Anybody else has one?
Mr. Chairman, in Ramsey County, as Commissioner Carter mentioned, we'd showcased several times where you were doing this work pre-COVID and you personally have led a lot. I would say Ramsey and Franklin County, Ohio, where Columbus is, have both done some cutting edge work. And those of you that are interested in participating in some of our peer networks, let us know. We've got a group working on economic mobility and a group working on more of the DEI work. But if any of you are interested, we're hoping post-COVID that we can get people back traveling where we can go visit some of the counties and sit down and dig deep into the thought process of the county, how they're approaching it. And we're really focusing on the importance of shaping your incentives, that, like the call I just got off on the conversation around data and equity. You have the wrong incentives, you get the wrong outcome. And people just start chasing goals and numbers and not really having real change. And they're gaming the system. So we're really looking at what are counties doing? How are you collaborating with others? And so again, we just want to hear from you. Like, what are you doing? How can we learn from it? And how can we share it?
Matt, thank you for being so generous with your time. And we all look forward to seeing you this summer in person, preferably. And if somebody can't make it, at least virtually. But
And
most of us on this visual will be there. We're going to do our best.
And I did see Derry Daniels, our liaison to NOBCO joined us. So Derry can also follow up with anything.
Thank you. Thank you very much.
Yeah, I forced her to turn on her camera.
Hey, Daria. Roy Charles, shall we move to the next one? Thank you, Matt.
Thank you, sir.
Yes, Mr. President, the meeting is all yours. Go for it.
Derek Albert, now your name is on the agenda. I don't know if it's you or Helen who's gonna introduce our presenters. It's your call.
Helen's going to
Dr.
introduce.
Holton,
I'm just going to
Dr.
say
Holton.
something about today. Thanks, Matt, for everything that you've done. You know, when we came up with the topic for the day, we were thinking about the disparities that are going on around the nation and communities with vaccine management. We looked at how many communities of color have lost a lot of vaccines from spoiling. And what we wanted to do was give you guys some opportunities to hear from some professionals that we vetted that can come into your communities, be helpful to you during this plan. Because just today in the Washington Post, the headline was DC's vaccine disparities are as big as ever. And when you look at 7% of the African-American community has only been vaccinated, those numbers will not meet the goals of reaching herd immunity by the fall so that we can all have all our kids in schools throughout this nation. So we wanted to give you guys some help and assistance by bringing on two of the best companies in this nation. And at this point, I'll have Helen Holton introduce them, but I will tell you this, the three people that I see, Nicole Francis Reynolds, a phenomenal young person who has done great things in this community, in this country, Chris Dilley, and Faradolf Biscoff will give you some of the best information that you can take back to your respective communities and help your counties. And don't be ashamed to reach out for them or get their contact information, because I guarantee you that they can help your community in some capacity when it comes to vaccine management. This time, Dr. Holton.
Thank you so much, Derek. Good afternoon, everyone. We're so glad to have you here. It might be good morning, depending upon what part of the country you're in, that you're joining us from. We're so happy to have you today. And two presenters, and we have two presentations going on. I don't know that Derek spoke to the other one, but we're going to do them back to back and then have Commissioner Ellis moderate the Q&A session. Our presenters today are Chris Dilley, who is the state and local chief technology officer and chief architect for ServiceNow. ServiceNow, an organization that's been doing what they do in the sector that they're in for a number of years. Chris brings a background of strategic leadership and accountability for re-engineering and modernizing of processes, supporting enterprise and customer and citizen service management, something that county officials can certainly relate to being in the middle of. But he also can focus on IT and business operation automation, because herd immunity in this pandemic is going to take some engagement of technology. Team members here are Nicole Francis Reynolds, as well as Elaine Garcia from ServiceNow. Our next presenter is going to be Faradolf Biscoff, who by all rights on some level is a Texan, in that she received her PhD in cancer biology from University of Texas Graduate School for Biomedical Sciences. and is also a postdoctoral trained MD, training at the MD Anderson Cancer Center at Baylor College of Medicine, there again in Texas. And so by all rights, I would just, for your benefit, President Ellis, here's another Texan on the team. We will hear first from ServiceNow and then from Fremont Scientific, and then we'll have a conversation around some Q&A and curiosity that you may have about how do I take this from here to implementation in my county. Thank you. I'm going to turn it over to you, Chris.
Thank you, Helen. Appreciate it. Nicole, would you like to kick it off just to level set it?
Sure. Thank you, Chris. To Dr. Holton and President, Chairman, Commissioner Ellis, and all of the commissioners and elected officials with NOBCO, we, on behalf of Bill McDermott, our CEO for ServiceNow, and the 13,000 employees that work for ServiceNow, we want to say hello and thank you for the opportunity to partner with you for the long haul, and to present before you today. I want to take a quick moment to say to Commissioner Ellis, I think that we should get 5 stars because I married a neighbor of yours who you know, and you know his son, Fred Reynolds III, and I recently saw a picture of you this morning from about 20 years ago, and it looks like you have not changed a bit. And so the Reynolds family says hello to you. Jarvis Stewart says hello, and Congresswoman Sheila Jackson Lee also says hello, who are dear friends of ours. And so good to see you. But we want to say again, thank you for allowing us to present today. I am the head of global government relations and have been in this role since September. And we are delighted to have brought on board Derek Albert and Jarvis Stewart and a host of other people who you may know, Lamel McMorris and others, to help us in this effort. We want to make sure that this cloud company, this platform that we have, helps all communities and enterprises. And you've probably seen our commercials where we say, let's workflow it. And that means that we use our platform to digitize workflows. We know that we've all been using old, antiquated software, legacy systems that are no longer efficient. And we are doing our best to educate others and policymakers and companies about who we are and what we do. If you like basketball, professional basketball, to be specific, we managed their bubble last summer so that the athletes could perform. Commissioner Ellis, if you recall Texas Southern going to the NCAA tournament several years in the past, my cousin Mike Davis was the coach and took them there. But we really care about making sure that sports leagues and governments and constituents who you all serve can continue getting the services and the access to the programs like unemployment that they need. And that can be done through modifying and modernizing these legacy systems. We have the ability to do it quickly, to integrate these legacy systems in hopes of them moving out of the way so that we can help you operate and do the things that you need to do. We're doing it with the vaccine, and Chris Dilley will explain more in detail, but we are working with a number of states, counties, country health systems, providers, and et cetera, whether it's from the provider side to the consumer or the customer. We want to create a customer, as our CEO says, a Michelin star experience for these programs. So I will stop talking, but just thank you again for having us, and I will pass it over to my colleague, Chris.
Thank you, Nicole. I appreciate it. And Commissioner Ellis, you did steal one of my, or I guess I maybe stole one of yours. I often introduce myself as a recovering enterprise architect. I was with the state of Iowa for about 11 years as an enterprise architect, focused really on transforming those social programs. How do we modernize those to really reach out to those that need it most in the way that they need to engage? And that's one of the great things. I love the industry that I'm in because technology is such a leveler for really connecting those who don't have the resources and some of those underserved areas. And technology has done that for me, and it continues to bridge that gap and help us get to those who need it most. So very excited to talk about what ServiceNow has done around vaccine management, but also what we're doing around in I heard a little bit about the rental assistance and the mortgage assistance programs that are coming out. These are the areas that really need modernization. And as we look at the volumes that states and counties are going to need to support these efforts, as these dollars come out, those are the types of solutions that we are working to really streamline and workflow and make better processes to get those that need those resources faster and more efficiently. I don't need to tell anybody that this is the greatest workflow challenge of our lifetime. You know, what we've been through over the last year. And if you think about the world population, and with 4 out of the 5 major pharmaceutical providers requiring 2 doses of the vaccine, and even looking forward that they're going to continue to have, you know, annual basis for a few years, we're looking at greater than 15 billion, you know, shots in the arm. And so when you think about this, we can't hire our way out of this. We can't throw resources and just human capital at this. We need to understand, how do we utilize technology and how do we really streamline processes and efforts to deliver this? So I had the great opportunity to be part of the core team as we looked at how we architect this and how do we make sure that we can meet those needs as we help governments, as we help healthcare organizations, as we help pharmacies deliver these shots in arms and turn vaccines into vaccinations. And so as we kind of look at the high level of what we're providing is really around that citizen engagement. How do we look at that inventory management components of this? And I'm gonna walk us through. With the time today, I didn't want to get too deep into a demo, but I'm just going to show you kind of how what some of these experiences look like and how we're helping countries like you know, NHS Scotland and Germany and Singapore and Australia, as well as a number of states and counties across the US, really utilize this and streamline what we're doing from a vaccine perspective. But as we think about, you know, the inventory management of this, you know, we've heard so many stories about, you know, the registration processes and either having too many people scheduled, not enough vaccines, or not enough vaccines and too many people scheduled. And so we really looked at how do we line that capacity aspect of this. And we've also heard about the storages of the vaccines themselves. We know that there was temperature requirements. We know there was coordination requirements of those. And how do we make sure that the quality of these vaccines gets to where it needs to be? And one of the important areas, and Nicole and I have talked a lot about this, is the pharmacovigilance and understanding from a monitoring and reporting perspective, what demographics, what individuals are having different effects from these vaccines, and how are we reporting that accurately up to those who need to have visibility to that. So as we not only coordinate the scheduling of those vaccines, how are we making sure that we understand the effects of this and the short-term effects, and making sure that we're doing the tracking, reporting, you know, back up to the CDC, back up to the health departments where we need to provide this information. And as we look at just the coordination of the resources that need to deliver this, we've got so many pop-up sites and so how do we make sure that the people that are administering the vaccines are coordinated, not just the clinical resources, but also the volunteers to really coordinate and manage all the resources we needed at a site, make sure we have proper PPE, make sure we have all the things to deliver this. Because we've all heard stories about delivering and not having the right, you know, PPE or whatever it is to coordinate this. And probably the critical and most important area that we need to, and I'll focus on this today, is really that experience for those citizens, those patients. How do we not only get scheduled, how do we manage and reschedule? We've had a lot of conversations about Texas. You know, when that storm hit a few weeks ago, there was mass rescheduling that needed to occur because people couldn't get out to get the vaccine. And so how do we make sure that we put as much of that in the hands of the people? We all have lives, things happen. We need to adjust and reschedule. We got to make that as easy as possible, especially as we get into larger volumes of the population. Just manual call centers can't handle this. So we've really focused on these areas to make sure that we put that in the hands of the users, the clinicians, the schedulers themselves, to be able to really optimize this and be able to manage it. But I'll dive a little bit deeper into these areas. So really the way we focus is that last mile. That last mile, how do we make sure that that vaccine gets to where it needs to? We have the right inventory. How do we make sure that we're coordinating those registrants, those people to be able to get that vaccine? We're qualifying, we're managing capacity, we're managing the capacity with the demand, and then we're doing the appropriate monitoring and coordination across this. And all of this absolutely has to have the scalability. We heard as millions, just like the rental assistance programs and the mortgage assistance programs, they're expecting millions of volume to hit these things. And it's often like the lottery. People are dialing for dollars to get a vaccine and coordinate these things. How do we coordinate this better and understand across demographics, across regions, across zip codes, to make sure we're allocating appropriately? Those are the things that we've taken into consideration as we've architected this application to deliver it out. Again, we are a technology company, but it's not about the technology. It's about the human experience and what we allow them to do and to help themselves, whether it's getting the common questions answered, whether it's registering themselves, or whether it's coordinating to get and receive the vaccine. You know, today, so many states, so many counties, so many healthcare organizations all have their own place where people go and register. And we're hearing so many stories about people registering at 5, 10, 20 different places just to hope to get called up. How do we coordinate that a little bit better? How do we manage that? Think of if you're going to just Delta Airlines and want to get a flight, but they don't have the flight options you need. And then you have to go to United, then you have to go to American, wherever. But if you go to Travelocity, you can look at all those things holistically. You can coordinate this across all the different providers of that vaccine and look at where I can find a schedule. How do I register myself? And then how do I coordinate this to know that in my zip code or my area, this is the availability that I have? How do we have that type of visibility and understand where we can go? And again, it's about registering, it's about answering questions. How do we keep people off phones? We know that there's some people that need that. We need that capability to provide call center support, but we want to be able to meet the needs of those at high tech, low tech, or no tech functionality. My mom, she wouldn't go to a website, but she needs a call center. But if she's competing with 10,000 other people trying to dial in to get an appointment, let's enable those who can help themselves, and let's enable the more low tech solutions or high touch solutions through other channels. And please interrupt me if you have questions and how we look at these things. I'm just going to kind of walk through this, but having an experience that's mobile enabled, that we can drive this to be able to schedule yourself and coordinate, when I need to show up, when I'm going to have my not only my first schedule, but also my second schedule. The way we've configured the application is to automatically schedule your second appointment immediately. What that does, it locks a spot in for the second dose. It also does is it helps us manage the inventory, because if we know we have one appointment, we know we're going to have to deliver the second one as well. So that gives us the visibility to provide and understand what inventory we need to continue to deliver this and drive this experience and be able to coordinate this across, again, whether it's a mobile environment, whether it's email, whether it's call center. We've got some great integrations. We're working with a few different locations right now that have actually tied in where it actually dials out through a call center to remind people the next day, people that chose that preference, to be able to coordinate that. So not everybody lives in their phone and email like I do, but there's a lot of those individuals that need those other reminders so we don't waste, so we don't miss appointments. And so we're optimizing what we can do from an experience perspective. And also the ability to reschedule. One of the things that's most important is as we look at how we coordinate these things and reschedule if something arises. Also making sure that we're capturing the right demographic and coordination information. So we know there's qualification information that we need to support as part of this, and all this is configured, all this is configurable, but this also helps us report. I'm going to talk a little bit about the reporting at the end, but the ability to understand what age groups, what demographics, what type of reporting information, so we can report that up accurately to how we're supporting our counties, how we're supporting our states and healthcare providers of process. So we are very much a low code configuration type of application. That's what allows us to stand these up in as short as 5 days. We've stood this up and really provided this to our users in a very short amount of time, because we know we can't take weeks, months to stand these things up. We need to be able to respond rapidly. And that's the kind of services that we provide. And again, the ability to help yourselves to coordinate and schedule the type of resources, and then having unique barcodes. and QR codes. You know, one of the things that we heard a lot about is somebody gets an appointment and puts it out on social media and multiple people can try to use that. Well, what that does is it cheats the system, it cheats the reporting, and it really is not accurate for how we're doing things. So providing a unique ID for someone to show up and have a low touch environment where they can scan this and also understand, who is who and try to drive that identity. The other thing that this provides is the ability to also, if they don't show, because we cancel both appointments. Because again, we've had people register in multiple locations and they don't show. But how do we coordinate this to make sure we're opening those slots up and then communicating to the next people that are lined up to support this? So that's very much, we really try to optimize that citizen experience to be able to deliver what we do. And we know and we believe that this is going to be ongoing. We're already hearing about the variants of the virus, and that they're already working on other vaccines to be able to handle some of those variants. But as different countries are looking at what they need to do maybe later this year or early parts of next, we know this is going to be ongoing. And then how does this tie in with the state's vaccination or immunization information systems as part of this? We also know we have to be able to provide a different type of experience and optimize the experience for the clinicians, for those who are handling those. So how do we marry those things so we can scan that QR code and know that this is Chris Dilley showing up? And we already know some of the demographic information or some of the risk information associated with that. So this helps us provide a better type of experience so we can make sure that we're reporting on all aspects of this and really driving a great experience for the workers that are keeping them safe from a low touch perspective, as well as those that show up and need to really optimize and streamline this experience. The way we've really approached this is from a command center perspective, because we know as counties look at this and manage multiple healthcare providers, pharmacies across, how do they have visibility? How does the county have visibility? How does the state have visibility across all those who are administering the vaccine? And how do we get that reporting rolled back up so we can make sure we can accurately look at and understand, do we need to provide more vaccines to this part of our county, to this pharmacy, to this healthcare provider? So we're having equality across our county, not just in certain parts of it. So having this type of visibility, having this type of insights, you can make data-driven decisions. So that way we're really optimizing what we're doing and how we're doing it and feeling good that we're being very transparent about it and making sure we deliver a great experience. And then how do we understand, again, where we continue to need to go? And this type of information, many counties and healthcare providers have been sharing this because this helps determine as we open up our cities and say, can we go from 25% capacity to 50% capacity? Because we're now at 60% vaccinated for our county, and look at those residents and make those data-driven decisions versus, uneducated guesses as far as the health and where we're at with some things.
Chris, I know that the president of NACO, Gary Moore, has joined us, and I'd be remiss, he may not have a lot of time. I just want to thank him for jumping in. Gary, did you want to give a quick hello? If you still
I sure do not want to interrupt this very important presentation. I just want to say hello to everyone. Thank you for what you're doing for NOBCO. Thank you for what you're doing for NACO and America's counties. And I want to personally invite you to our in-person and virtual annual conference coming up July 9 through 12. So I'll stop there, Commissioner Ellis. And
you are Mr. President. You got me? Well, I like to ring it at Mr. President.
Well, thank you, sir. And I do appreciate it. But unless you have any questions for me, I'll let you carry on with your great presentation.
We just thank you for all that you're doing.
Thank you.
I learned that Roy Schultz taught me how to respect presidents.
Oh, I bet he did. Yes.
Thank you for joining us, Gary.
Oh, thank you, Mr. President. All right. I might listen in here for another minute. I'm finding this very interesting.
You're welcome to stay.
All right. Thank you.
Chris, it's going well, Chris, and I know I want to keep us on schedule. And I talked about being a recovering legislator, but it's very interesting.
No, absolutely. And that was that was the last part of the visual portion. So any questions? Again, we are working, I think we just passed our 100 millionth vaccine administered through our platform globally. And so that's incredible. And again, why I'm excited about the state and local government and education space is because it helps people. We are helping people, and we're utilizing technology to help people. And it feels good to know that as we're driving that and getting everyone back healthy, and we're excited to high five and get back with people face to face, and excited to hear about your in-person conference. And I hope we can do everything we can to get there.
Chris, is very important. And from Harris County, I know others, we're going to follow up with you or Nicole or Elaine. It is very helpful. And some folks may put something in the chat box, but I know I want to keep us going. But look forward to a call from Harris County.
You know, to keep us on schedule, one thing I like to do, Chris, just be thinking about this at the end. I'd like for you to talk more about the disparities and how you guys can help with that, how you can help get people back to work, back to schools, the way you did help the NBA in that bubble, and how we can help our constituents who don't have transportation or technology, internet, to be able to schedule this. So if you could talk about that after the next presentation, we truly appreciate it. And at this point, Faraday, thank you. If you can come on now.
Thank you.
Thank you. Hello, everyone. I'm just getting my slides up and then I'll introduce myself. So thank you all. Thank you, Derek, so much for the invitation. And I'd also like to extend a warm thank you to Commissioner Ellis, Dr. Holton, as well as President Moore for joining this presentation. By trade, I'm a scientist. A PhD, in fact, in cancer biology, as you heard early on. I am a Texan. I've lived in Texas for over 30 years now. And in fact, I'm in Fort Bend County, not far from Harris County. I did all of my training and education in the Texas Medical Center, which I hail as one of the best in the world. So I'm very honored and privileged to be here today to present the technology that our company, Fremont Scientific, has developed and now commercialized. This is a technical talk, but I'll try to keep it really high level around what we deliver, and then I'm happy to go into any of the details or specifics. Our platform is called ZipThaw. ZipThaw is an acronym that simplifies the fact that we very quickly thaw product. We have FDA clearance, and that clearance is intended for plasma for the purposes of transfusion. We are a portable device and very easy to use, and therefore we qualify as point of care and on-demand delivery. So in addition to being the Chief Executive Officer of Fremont Scientific, I'm also the Chief Scientific Officer. But as I said, I'll try to hold back some of the more intensive scientific discussions. So where are we today with the vaccine administration, and more specifically, what are the challenges we face where a technology like ours can address? As we all know, the Moderna and Pfizer-BioNTech vaccines are novel technologies, and they're novel in the sense that they utilize a new platform around the use of mRNA. mRNA is a nucleic acid that naturally exists in all of our bodies and cells. This mRNA is encapsulated in a lipid or a fat-based process. As a result, although very effective, the material is quite vulnerable to degradation. And this is specifically the fact when you warm it up at temperatures beyond freezing levels. And this is why early on in the distribution of the vaccine, we all heard about some of the challenges in keeping the vaccine cold enough for storage. We're now able to store at slightly warmer temperatures, but these are still frozen vaccines. And the thawing process needs to be controlled in a manner such that you minimize any destruction to that mRNA. So as listed here, the mRNA is quite fragile. It degrades easily at room temperature, and therefore inappropriate thawing or defreezing can cause the potency or the activity of the vaccine to degrade. In addition to thawing right out of the freezer, if you have unthawed vaccine, it's not suitable really for restorage. And that is because as soon as the material is thawed or defrozen, it stands, there's a risk of further degradation and ultimately waste. If it's stored and not used within a window, it's then thrown away. And then I don't need to talk about the sources of enzymes that chew up this mRNA, but these are readily in existence, and we really can't remove these from our environment because they're there as a natural precaution against these viruses and other materials. So unless you do the thawing properly and under controlled conditions, the resulting dosage can in fact vary. The pharmaceutical companies, have not, I think, addressed this component, and we'll look at that in a second. So the objective of this presentation is to present a technology that can provide quality controlled thawing in a manner that is not only safe, but effective in reducing the chances of waste, but also being effective. Okay. So how are we thawing today? And these are just images I captured off the internet, and not to indicate that this is exactly what's being used, but quite simply, the two options that are in practice are either thawing the vaccine on a bench top for a given period of time and then using it immediately. The alternative is to thaw your vaccines in freezers. These are mass quantities that are then thawed. However, there are risks associated with both. The risk with a bench thaw, obviously, is that you don't have a controlled way of thawing, that it really is subject to the environment and what you're exposed to, and therefore risk of contamination or even exposure to elements in the environment like increased high temperature that would cause degradation is possible. With the freezer approach, the length of time it takes to thaw or defreeze can vary. It may vary depending on how many vials you have and whether it's been frozen at -80 or -184. All of those components contribute to the time it takes to thaw something frozen. Very much like thawing your turkey during the holidays. If you put it outside, it thaws faster, but you might feel that the outer parts are warmer than the inner parts. And similarly with the freezer, it'll take at least 24 hours to thaw. So in addition to the time and efficiency, there's also a footprint issue. Many of these freezers, for the quantities we're considering, are quite big and take up space, just like your bench space. And finally, freezers today require monitoring of their temperature. This needs to be done in order to ensure that the vaccines are maintained at that proper setting. So what's the alternative then? The alternative I'd like us to consider is the ZipThaw 202 system. The images here show you the ZipThaw itself. It's portable handheld device. You see a handle here. And with the image of a hand, it gives you sort of perspective of size of the device. It's about the size of a carry-on suitcase. It's lightweight and, as I indicated, portable, but very easy to use. I, in fact, did a demo 3 days ago, and it's literally 3 steps to get your sample into the device and start thawing. It's currently FDA cleared for thawing of plasma, as I indicated in the beginning of the talk. And this includes convalescent plasma. With the onset of the pandemic last year, our company quickly pivoted to understand where do we have alignment with what is needed today in the battle against this virus. And immediately we were able to demonstrate efficacy in using our platform to thaw plasma that's been collected from patients who have recovered from COVID, to then use that plasma for treatment in severe cases. The diagram here, you just need to know that the blue bars are pre-freezing and the orange bars are post-thaw on zip thaw. And in samples from convalescent plasma samples where the antibody levels are critical, we show phenomenal recovery to the level where what you recover is nearly identical to what was in the sample before it was frozen. The image here just shows you again perspective in terms of the device sitting on a benchtop in a lab. Along with the device is the consumable zip sleeve. The zip sleeve is a disposable anti-cross-contamination pouch. I call it a smart bag. It's a smart bag because it's equipped with a RFID sensor. The sensor is this dark area in the bag, as you see it here. The sensor ensures that we thaw your substance precisely to the temperature that you want that material to be. And the device, in fact, measures the temperature of your sample as it's thawing, as opposed to the environment. In a water bath, often the water bath measures only the temperature of the water, not your sample as it's thawing. So you're relying on whatever the end reading temperature is of that water bath, which could be off and not representative of your sample. So together, the zip thaw and zip sleeve create a platform that allows you very fast, robust way of thawing your material once it's been frozen. So the question you should be asking is, well, does it work for vials, and ultimately, does it work for RNA? So early this year, in fact, January of this year, we did another pivot to determine the efficacy of thawing material that comes in the volume that the vials come in, but more specifically mRNA itself, because I can't stress how delicate this material is to environmental exposure. So what you see here is your typical size vial, and I believe the configuration here is comparable to the Moderna vial of 20 mLs once it's ready for dose. And then you see our zip sleeve and our zip thaw. What we have developed is an adapter. This adapter is a simple cutout that allows you to place the vial in and sit right over the sensor, so that with no modification to the device, we can easily now thaw this vaccine material to exactly the temperature we want, and do it when we need it, because it only requires a few minutes, and you'll see in a moment. And this is just a cartoon I wanted to share with you because one of the, in working with Derek Albert, one of the questions he asked is, well, does it work? And how much time is it going to take you to get ready to do this? Well, this illustration shows you a basic sponge that's been cut to allow the space of a vial that you can now easily slip into the bag and go directly into the device. So the actual amount of time it will take for us to develop this is not long at all, and in fact, it's done. We just need to manufacture these adapters. And indeed, we've collected data now to show from the scientific side that the mRNA is indeed preserved after thawing on zip thaw. And this is just this slide just highlights how the experiment was performed. We did this through the San Diego Translational Virology Lab, where they routinely run assays for mRNA, so there was no learning curve there. Myself and my colleague, Linda Fabian, who's on the call here, carried 2 zip thaws into the lab and conducted this experiment ourselves. And very simply, we collected a plasma which contains a lot of mRNA in vials that are a quarter of the size of your vaccine vial. So very stringent conditions. I tried to design it such that it would be its most difficult criteria to fit into the system for testing. And what does that mean? We tested 1.5 mLs of plasma in match sequences of material that has never been frozen, therefore never thawed, plasma that's been thawed at room temperature, and then plasma that was thawed in the zip thaw. And the method we used for detecting signal is called quantitative PCR.
So, Ms. Bishop, I want to
Yes.
make sure that we can take maybe a question or two. So you.
I'm almost done here. I'm just about done. Almost done. Thank you. I won't be longer. So these are the control data. There's no background. The positive data show that, in fact, when you thaw your RNA, you get RNA back on zip thaw. And this is nearly equivalent to room temperature as well as before freezing. So where is the benefit? The benefit is zip thaw allows you to thaw your vaccine now in minutes as compared to hours. It also allows you to minimize or remove the likelihood of waste by maintaining safety through the consumable zip sleeve. Thus, you're not throwing away any vaccine and you're maximizing the efficacy of your material. We're manufactured in the United States. We have 2 manufacturers, Minitronics Medical and Boyd Technologies. We have FDA clearance and a whole host of certifications that indicate safety. And we've secured our supply chain for scaled production of 1,300 units by mid this year. We're also on our way with FDA EUA issuance. So the advantages, I hope, are clear. We offer portability. We offer controlled thawing at a level which is very precise. We deliver thawed product in minutes as opposed to hours. And of course, we maintain safety and efficacy. And with that, I'll conclude. And this is our team, myself, our 2 co-founders, Linda Fabian, who's on this call, our product manager, and our director, Joe Cohen. Thank you. Thank you so much.
And Derek, thank you for getting 2 outstanding presenters for us today. Here's what I would suggest to keep us on schedule. If you would put both of your presentations and your contact for us in the chat box, we'll have the presentation, particularly Ms. Bischoff, those of us who got that C in biology, so I can review it. So when I call you, I sound intelligent. My staff can make me sound intelligent, but it was very helpful for both of us. I had heard of ServiceNow. Derek mentioned it to me some time ago, but both were very good. So members, if that's all right with you, put it in the chat box, and if you have questions, we'll follow up.
Commissioner Ellis, I do have the presentations that we'll put on our website for people to be able to pull them down from our resources.
Well, and now that I figured out how to work the chat box, I'm only on Zooms all day, Now that Roy Charles has taught me how to work it, I forgot to mention earlier if the president is still on Gwinnett County. The president was on the line earlier. I know that Gwinnett County, Georgia had 4 members of their commission to join. And we have one of their new commissioners is going to introduce Harper later on today. But President, if you're there, I want to let you say hello. And if we have any other new members, Helen, I got your note, new members, I want to let you give a quick shout out if you'd like to now before I go to the resolution.
Well, what we'd like to do is have them put that information in the chat box, and we'll wrap up at the end just to acknowledge them and thank you for being here. If this is your first legislative conference with NACO and that you're joining our meeting, we certainly want to recognize and acknowledge you today.
Helen's so good, and Dr. Holton keeps us on schedule, by the way, and I appreciate it.
Commissioner Ellis,
Yes.
I would like to recognize NOBCO's newest member of its board of directors, Los Angeles County Supervisor Holly Mitchell. If Holly is on the platform, please make yourself known, Holly.
We had a great call last night. She sent me a text. Well, I guess with the board, we were on for about 2 hours last night, I think.
Yeah, she's not here with us right now, Commissioner Brooks, Mr. Chairman.
If I might, I'm going to go to this resolution quickly, Helen. Is that all right?
Yes, I'll pull it up on the screen.
So the NABCO board last night passed a resolution in support of state and local efforts to create fairness and consistency for peer-to-peer car rental companies. Now that my wife and I are about to be empty nesters, when the last one packs up to go to Syracuse, I hope there's some commissioners on the line from New York so they can watch out for my child at my age when she's a freshman at Syracuse in the fall. If we decide to take her car and make it available, let somebody drive it for about a month, I hope that I will have paid the insurance. I hope it does not fall apart. But it's a version of what people do with Uber or Lyft or car rental. But the difference is, I won't be paying taxes so that I can service the roads and a host of other things. We don't have ordinance making power in Texas unless the legislature gives it to us, but some of you do. So just in case your county is interested, we want to make you aware of it. It's pretty straightforward, does not lock you in anything. The Conference of Black Mayors adopted it. The U.S. Conference of Mayors adopted it. Mayors in our state in particular are worried about cars on the road that contribute to traffic congestion, wear and tear on the road, but don't put any money in. So they're looking at ways to make sure they capture some revenue in case Alicia and I decide that we're going to lease Alina's car out to help pay for college tuition so that the taxpayers will get some of it. So just look at it. We're just making you aware of it since the NABCO board did adopt it. And if there are any questions on, please put them in the chat box and I'll make sure we come back to them. Derek, was that quick? Because now you and Roy come up to talk about the NABCO Academy and the 2021 EDC. Now, how's that, Roy Choice? How is that? 26 years in the Senate with all those filibusters. Of course, with my health issues, it was always a threat. Sometimes people would vote for my bill. They said, just don't let him get up and filibuster. So have I got us back on schedule? We're only 3 minutes off. 3:07 your time on the East Coast, 2:05 my time. I'll turn it back over to you, Derek.
And Commissioner Ellis, just so you know, I have put the peer-to-peer resolution in the chat box so people can pull that down.
Yeah. Roy, am I on time or do you want to jump? I saw one of our.
You are on time, sir.
Okay, jump to the academy real quick. And
Go
then
ahead.
Joe, I see you.
Just so you know, Commissioner Marianne Borgeson is in the room with us, immediate past president of NACO.
Madam President.
Commissioner Borgeson a chance to say a few words.
Yes.
Marianne, I understand you broke your foot.
I broke my fibula and my ankle, so I did it up good.
Well, I hope that's it. You didn't get COVID while that foot was broken and you were
Oh,
convalescent.
no, and I got my first shot done, so I'm on my way to recovery with all of it. So, but no, it's good to see all of you. I was on for a little bit and had to jump off, and so now I'm back, but it's good to see all of you. And again, thank you all for everything that you do, and we appreciate it very, very much. So it's good to see all your faces, but I absolutely can't wait till I can see you in person and give you all big hugs.
It's good to see you, Mary.
I like this, Roy. I like it a lot.
Thank you. So, NABCO Academy is a response to the fact that our kids have suffered greatly during the pandemic by not being able to be in school, in class with a teacher. And online learning is difficult in the best of circumstances, but when you are a first grader from a inner city elementary school, which is located in a neighborhood that is insufficiently wired for Wi-Fi, then the challenges just multiply to a point where that child's learning is impaired. The NABCO Academy is designed to try to fill that learning gap by putting those students online with a teacher who is skilled in online learning techniques and is able and willing to engage with these children to move them forward towards where they need to be. Now, with that brief description, I'm going to turn it over to our Vice President for Economic Development, Mr. Derek Albert, and let him flesh the program out for us.
Thank you, Mr. Chairman. I'll be brief because I know we want to stay on schedule. One of the things that NABCO is known for is giving out scholarships for the last 35 years. That's how I got involved when you guys gave me a scholarship when I started college. And what we did when the pandemic occurred, we decided to utilize those resources and invest in our young children as opposed to college age students, because we saw there would be a greater need for our first to third graders to keep them on track because they had to learn virtually as opposed to being in-person learning. We took those resources and we've been developing a program that has been extremely successful. If you have some time, check out our website. You'll see the progress that the students have made. We piloted this program in Fort Worth, Texas, the first year. We plan to expand it next year, and we're doing a lot of great things with it. We'll have more to discuss on this at our annual conference so that you can participate, and hopefully we can bring this to your community as well. We plan to keep the NABCO Academy going because we think that it is essential for the learning and growth of our children in our communities. And that's basically it right now. And hopefully we can be back on schedule. Mr. Vice President, we have a visitor that you want to introduce.
Well, just a minute, unless Derek, you were going to talk about the EDC or you're going to wait on that?
I'll wait on EDC.
Okay.
Thank you, Derek.
Roy Charles, you're going to introduce, or Helen, you're going to make the introduction of our candidates for second vice president.
Yes, I will take care of our candidates for second vice president. As you know, NABCO and NABCO have always been affiliate organizations to entertain any candidate running for second VP. Well, there are 3 candidates in the race. One of them did reach out to our office asking if they might say a few words in support of their candidacy. And as has always been our practice for as many years as I can recall, we're holding to that tradition. And so I'd like to introduce to some, present to others, Commissioner Mary Jo McGuire, who was elected to the Ramsey County Board of Commissioners in 2012 and represents all or parts of 6 suburban communities in Ramsey County, Minnesota. Rather than have me go on about her, she's been very active and engaged in NABCO, never taking on direct leadership positions, but always being part of that wind beneath the wings of leaders who have been serving in a more public way within NABCO. She does serve within her own county, though, in her own right, and has chosen to bring her expertise, her knowledge and experience as not just a county commissioner, but just as a public servant to seek higher service within NABCO. At this time, I'd like to turn it over to Mary Jo McGuire.
Wow. Thank you so much, Helen. That was beautiful. I appreciate that so much. It's great to see so many friendly faces here. President Borgerson and Roy Charles Brooks, it's great to see both of you on this call. And Rodney, I wish we were biking, and Renee, seeing you again. And it's just so good to see so many friendly faces. I also, my good friend and colleague, Tony Carter, who I am so appreciative that I get to serve with on a daily basis. So just great to be here with all of you. And Christy Fontaine from Healthy County, it's good to see you. But anyway, I am Mary Jo McGuire, and I'm excited to be running for second vice president of NABCO. I want to tell you just a little bit about myself, because I know I'm not going to take too much of your time, but I just think it's important for you to know where I come from. So I grew up as the second oldest of 6 children in a small suburban city of Falcon Heights, Minnesota, home of the Minnesota State Fair, which I love. Our parents taught us the importance of listening, learning, caring for each other, and the power of a positive attitude. I spent 16 years in the Minnesota legislature, Rodney knows about that, serving in both the House and Senate. And for the last 9 years as a county commissioner, I've learned that the way forward is by leading together. I'm passionate about education and have spent much of my life teaching and leading civic education and engagement efforts. This experience has taught me that we must provide everyone the opportunity to participate and use their voice. This is the backbone of our democracy. Counties everywhere are facing unprecedented challenges. We are the front lines of crucial life-saving public health and safety efforts. I've been an active member of NABCO from the start, building relationships, sharing information, advocating for issues, and I'm also in leadership in my own state association. Much of this work is focused on bringing counties together to achieve common goals. The more involvement and participation we get from everyone, the stronger our counties and NABCO will be. We're all in this together. So I'm proud of my leadership in NABCO committees, including chair and vice chair of Healthy Counties, Justice and Public Safety, and Programs and Services, which I was excited to be vice chair with Keith Carson as chair. I'm running for NABCO second vice president because I'm dedicated to the continued growth and success of this organization, and because I have the energy and ability and that positive attitude to lead us forward together. As your second vice president, my top priorities will be increasing membership and engagement by ensuring that all counties see themselves reflected in NABCO's work. Growing our partnership with Congress and the administration. NABCO has just had an incredibly successful year advocating for our county's needs. We need to continue educating Congress on the expansive role that counties play and how we can help each other to collectively better serve our residents. And bringing America together. We know this is so important. We are a country of many viewpoints and backgrounds. I will work to help us focus on the values that we share, as we have always been stronger when we work together. Lastly, and most importantly, let me say thank you to you as NABCO members for your important leadership in NABCO. Of course, you know this more than me, but it is clear that with the health, economics, and social well-being of Black Americans hardest hit by the pandemic, and with social injustices laid bare, such as in the televised death of George Floyd in Minnesota, and in so many areas across our country, It's clear we're long overdue in addressing the impacts of racism in this country. I look forward to working with you at NACO, as I have in Ramsey County and in Minnesota, as an ally for racial equity and ensuring healthy counties for all of us. I look forward to connecting with you again over the coming months. I'm excited for this opportunity to serve you, and I ask for your support. Thank you very much.
Thank you, Mary Jo, so very much for joining us and sharing your perspective and what you would bring to NACO as its next second vice president. Thank you for coming to join us today. Commissioner Ellis, you wanted to say something?
No, just thank you, Mary Jo. I've known you a long time, and in our previous lives, we've ridden bicycles around the country and the world with our bipartisan bike rides, and we brought that to NACO and NABCO. Roy Charles, next conference, you on a bicycle. Friends, Tony Carter on a bike. Renee, when we get to DC, to Gaylord, on a bicycle. Get ready.
Very good. Thank you again, Mary Jo. Please stay with us if you can. I know the busy schedule of candidates during this time. At this time, I'd like to recognize one of our newest members, and in the vein of Derek talking about investing on the front end, and not that we don't want to invest on the back end, but it's important to nurture, mentor, and encourage the next generation of talent rising to the forefront. And so to introduce our next speaker, we have Commissioner Jerica Cobb from Cobb County's District 2. Excuse me?
Richardson.
Oh, yes, Jerica Richardson from Cobb County. Okay, yes. District 2, serving as a fierce advocate in her community and representing the intersections of technology, business, and public policy, which today, if we don't understand and appreciate the role of technology in our very connectedness, then we're missing something out. She is a non-traditional track public servant, such as I was when I came on the scene 25 years ago, but has used her knowledge, expertise, and passion for the people to offer herself up for public service. She comes to the Atlanta metropolitan area, originally from New Orleans, after Hurricane Katrina with her family, and has planted herself here in fertile soil to make a difference in Georgia. Commissioner Richardson, welcome. We're so glad to have you with us today.
Thank you so much for that very gracious introduction. And hello, everybody. Good to see you. And sorry, I'm clicking on things right now to make sure I got some items up. So yes, just really grateful to be here. Grateful to learn more about the organization. We did break a lot of barriers with my election. I am the youngest and first Black female for Cobb County in this area. And we have quite the powerful district. It is one of the most affluent districts within the metro area outside of Fulton County, outside of the perimeter, really. So we've got the Brave Stadium, we've got very vibrant economic driver for the county, and about 200,000 people within my district. So grateful to learn, be mentored, and find new successful ways to pave real success for our different communities. That being said, I am here to introduce a really wonderful guest. That is Hill Harper, best-selling author, renowned actor, problem solver, philanthropist, and community investor. You may know him from CSI New York, Limitless, and my favorite, The Good Doctor. Outside of TV and film, he is heavily invested in the advancement of the community, seeking to solve systemic issues and a proponent of the new Black Wall Street. He sticks to the data and pushes for real outcomes. He is committed to partnering with us from a leader to leader in solving the wealth gap in all forms. Credentials ranging from Brown University as an alum, Harvard Law School, Master's in Public Administration, member of Alpha Phi Alpha Fraternity Incorporated. He's also a friend and teammate of President Obama on the basketball court and in the political arena. What an incredible story of contribution. It is my absolute honor and pleasure to introduce, as stated before, Hill Harper, best-selling author, renowned actor, problem solver, philanthropist, and community investor. Thank you for all that you do, truly.
Thank you, Commissioner Richardson, for that beautiful introduction. Thank you so much. Hey, everybody. It is such a pleasure to join you. When I think about this group, I think about how important it is. I think about Dr. King's quote where Dr. King said, "We're all tied together in a single garment of mutual destiny." And I think that that's so true, of looking for ways for someone from the private sector, such as myself, to have strategic partnerships with you officials in all of your different areas. That, as Commissioner Richardson mentioned, the area that I'm leaning into has to do with my book, the Wealth Cure, dealing with this wealth gap. And what's brought to mind for me is one of the most sobering statistics that I know of. It and breaks my heart that in 1863, when the Emancipation Proclamation was signed, Black people in America held a little less than 1% of American wealth. And right now, in March of 2021, Black people in America hold a little less than 1% of American wealth. It's unconscionable. And I truly believe that coming out of 2020, that you cannot have social justice without economic justice. And so my work is leaning into how can we solve the wealth gap? How can we deal with these really deep issues when whether we want to talk about educational gaps, whether we want to talk about criminal justice reform and incarceration rates, whether we want to talk about health disparities exposed obviously by COVID, et cetera, or whether we just want to talk about simple pay equity and all the issues that sort of run through the fact that there is one thing that links all of these social justice problems and social inequities, and that's poverty, and that's lack of foundational base. And there's a saying, it's expensive to be poor. And what that means is that 95% of the financial products offered to our Black and brown and marginalized communities are either on their face predatory or hidden predatory. And I wanted to lean in and try to solve these issues. I know for many of you, from speaking with Derek and many of you, that payday lending, check cashing spots, rent to own, and all of these onerous means of having folks in your communities working 2-3 jobs but barely making ends meet because so much money is being ripped out from under them in so many different ways. We can actually solve these issues. We can actually lean in, and through a tech platform that I've developed to recreate the actual brick and mortar version of the Black Wall Street that created group economics. We're launching a platform next month because April is Financial Literacy Month. And we're going to do a 30-city tour, and we'll probably be coming to an area near you. And so if there is a way or a reason or a desire for financial literacy, financial empowerment, financial capability in your area, I'm literally spending millions of dollars of my own money, investing it in the community, investing it into this app, because we're in this extreme intersection point where we're moving from fiat or paper money currency into digital currency. And if we don't get ahead of this right now with our constituents and our people, we again are just going to see a reverse of what I call the digitization of payday lending. What do I mean by that? Let me break this down. No one's talking about this, and this is why it's important. There's an app called Cash App. I'm sure you've heard of it. Jack Dorsey, who is the CEO of Twitter, he just gave Megan Thee Stallion $1 million. He talks about Cash App as the culture. He's trying to get as many Black people on Cash App as possible. He's doing a 500 Bitcoin giveaway with Jay-Z in Africa. He just bought Tidal, the majority interest in Tidal, which was the last Black-owned music streaming service. And Square, which he owns, the payment services company, just got their industrial bank license. Doesn't take a genius to see what's happening here. You get as many Black people onto Cash App as possible, and then you start saying, hey, Black and brown people, don't worry about that bill. We got you. Pay for it on Cash App. Go on, you're going to be okay. Don't worry about that. And then what's going to happen is our community is going to be locked into paying interest, 10, 15, 20, 25% onerous payments into these PayPal, Cash Apps, Venmos, etc. And that's why the Black Wall Street is being launched as a digital wallet and digital service to create recirculation of our dollars in our community to deal specifically with the wealth gap. I can't sit on the sidelines and see this happen before our eyes. And I hope that you will join me in dealing with this. If the host allows me to share the screen, there we go. I'm going to share this video. It's only 40 seconds, but take a look at this. This will give you a sense of what we're building, moving towards the centennial of the Black Wall Street. We couldn't be more excited about it, and we hope that you'll join our movement.
Welcome to the Black Wall Street. We are going to cure the wealth gap on this platform. You can't have social justice without economic justice. There's no way to build wealth if we aren't recirculating our dollars, if we aren't creating institutions that we own and then supporting those institutions. We need to build this community one person at a time by recirculating our dollars, investing and building wealth. Join the Black Wall Street. Black cash matters.
Black car, black rose, more black CEOs.
I believe in the original Black Wall Street, the brick and mortar version in the Greenwood District in Tulsa, Oklahoma, there were 3 specific pillars that created group wealth. Pillar number 1 was institutional ownership. Pillar number 2 was institutional trust in those institutions. Pillar number 3 was the movement of money or capital within the ecosystem, where a dollar changed hands 60 to 100 times before it left the ecosystem, up to a year or more. Recirculating dollars, creating jobs, because we are supporting Black businesses. And if I go to the Black barber shop and he needs to hire another barber because he's got enough, that's a job that's created. And that new Black barber gets some money, he's going to take it to the Black butcher. And then he's got to hire someone to help him. And then we create jobs. If we're not recirculating our dollars, we cannot. Right now, in today's economy, a dollar leaves the Black community within 6 or 7 hours. And if we don't stop what's happening right now as we move into digital currency, it will leave the Black community within 6 to 7 seconds. We have to create our own tech-based platforms that we own, that we create these microeconomies, that we circulate our dollars by onboarding Black businesses into the tech marketplace, into the tech microeconomy, and we recirculate our dollars in a digital space. This is an urgent call because all of this is happening over the next few years. And if we don't move now and move quickly to be at the forefront of this tech digital currency revolution, we're going to be left out, left behind, and in debt. I need y'all's help on this. I need your support. Anything you're doing in your community that this resonates to, please let me know. I'm spending my resources, my time, my sweat equity, and my real equity on this issue. Robert Smith and I were on a conversation last week. He's leaning into this with me. We're going to roll up some MDIs as well and raise some tier 1 capital so we can start giving Black businesses loans between $5,000 and $50,000 on a digital platform. We have to do this. We have to recirculate our dollars, and we have the tech to do it. So thank you so much for giving me the time. I welcome strategic partnerships with any of you out there, and I really appreciate you all leading into this issue because this is the moment, and the time is now. And if it's not us, then who? And if it's not now, then when? So thank you so much.
Hill, thank you so much. Truly appreciate the words that you brought to us. I do believe that it is there are opportunities with counties throughout this country to partner with you as we see payday lending up and communities of distress from banks closing and within our communities. I think that a lot of these commissioners can go back in their respective communities and look at how they can help your platform and help our communities and save people in our communities from spending more with rent-to-own companies and payday lending, and create an avenue to be more helpful to what you're trying to accomplish. And I really appreciate you doing this. Are there any questions? Mr. President, Mr. Chairman?
Yeah, how can we help? Hill, this is Rodney Ellis from Houston. And look, it was very inspiring. Just as a comment, simple question, Jesse Jackson gives a great speech about the last phase of Dr. King's struggle was to integrate the money. And I know all of us as county officials aggressively following the lead of Maynard Jackson, commissioner out of Georgia. I know they celebrated his life a couple of weeks ago. They had something, Mac Wilborn told me out at Maynard's gravesite, in fact. But we're pushing for disparity studies so that the dollars we control, more of them go to women, African-American women in particular, Hispanics, Black-owned businesses. But look, I'm going to think about what we can do. Derek, I know Hill is here in part because you, his running buddy, you had him spend plenty of time with us in Detroit, so we're glad to have you. But Hill, we appreciate you and admire you for putting your money up with your commitment. So we're going to figure out what we can do to work with you.
Thank you so much. Thank you. I appreciate it.
Mr. Chairman, one other thing, I do want to thank Commissioner Richardson for coming on at the last minute introducing Hill. She's one of 5 county board commissioners in Cobb County, which all 5 are women. And I believe 3 are African-American women. Am I correct?
Bravo.
You're absolutely correct.
Thank you so much. We look forward to working with you. And at the end, if our
Correct, they are the controlling majority, right? So, not a partisan topic, but yeah.
It's the same situation in LA County, 5 women.
Yeah.
Supervisor Mitchell shared that with us last night. That it's the historic commission in LA County, all 5 women.
I think it's important that we connect the 2 counties so that the women can, I guess,
lead us.
Yeah, we'll make sure you connect her with Holly, by the way.
Yes.
Hill, I called Holly a couple of days ago, and a couple of the legislators in California. That's an amazing legislative accomplishment to pass a bill where publicly traded companies that are based in California, if you don't diversify your board with regard to gender, LGBT, and racial ethnic diversity, you have to pay a fine within X amount of time. And of course, NASDAQ has followed suit, threatening to delist companies. I know that Congressman Meeks and Maxine Waters, I guess, have come out of one of their committees. And the senator from New Jersey, not Corey, his colleague, are pushing it on the federal level. It'll be hard to get around the filibuster, but there's a big push to integrate the corporate boardroom. And I think that is in line with what you're doing. So thank you.
Without question. And importantly, I must say, we have to save our MDIs. If you look at actually money flows and investment in the Black community, only 1% of loans from majority banks go to Black folk, whereas 67% of the loans from MDIs go to Black folks. So we've seen our MDIs basically cut in half. And if we actually allow that to continue, it's choking money flow and investment into our community because they're not writing us loans, and the loans they're writing us are significantly more expensive because of, obviously onerous credit ratings and all of the things that have been lobbed on us. So boardrooms are critical, MDIs are critical, and investment in tech is critical because what's choking our MDIs is the fact that they don't have 21st century tech and digital money movement platforms like we want to add in, and that's what Robert Smith and I have been talking about bringing to the MDIs, and that's the work we're doing.
So maybe what we can do, what our leadership, our board members, and the new commissioners as well, maybe we can pull together a Zoom with the Black Caucus of state legislators. We can obviously get the mayors as well, but it would be more enlightening than a lot of the Zooms that I have to get on, by the way. I think we could do that and figure out, it was great to put the video in. Most of us who end up in this line of work, politics, tend to have a little ADD because we have to juggle so many hats. But we think about it. And your celebrity status, Ann Smith, Derek, Texas, by way of Denver, but Texas now, Austin, might I add. But that's a great combination, and I appreciate what you're doing.
Hill, I'd just like to say, if you'd like to send me that video that we could put on our website to make it available to members so that if they go there, and we're going to take this recording of this meeting today, and a one sheet, something where we can direct them to go and get the information that you're sharing with us.
Absolutely. And it's on theblackwallstreet.com. The video plays as well as a sign up, and that in and of itself is critical, because that's going to help us. The more people that sign up is going to help us show that there is a critical desire in our community for digital interaction around money movement and capital flows. And I truly believe we can be our own reparations. You know, if we actually are intentional with our $1.2 trillion of spending power, all of a sudden things start to change. But we can be intentional in a digital platform.
Thank you, Hill Harper. Thank you very much.
Hill, it's Roy Brooks. I just want to say that your relationship with NABCO is not a new one. You've been with us for a good many years now, and you never fail to challenge us to be more and to do more with what we've got. I think this new venture of yours is just what we need at this point in our history. And NOBCO and NABCO stand ready to partner with you to, as you say, lean in with you to build some platforms that will lead to closing the wealth gap between them and us. So I thank you for being with us today.
I want to thank everybody for staying on.
Chairman, I have
Roy,
one last thing to say.
Eric, anything else before we wind up? Go ahead.
Just one
Eric.
last thing. June 2nd through 4th, we'll have our EDC, which will be virtual. We will focus on democracy, and is democracy dead in America? We have some top talent coming in to speak to the issue, dealing with voting rights, dealing with economic rights, health and wealth, and we want to make sure that everyone participates. It'll be a virtual short conference. We won't do like NACO did and have spread out all over the entire month. We're going to spread out just a few meetings over a course of 3 days and come with a strong agenda that you will appreciate. But be thinking in the lines of, is democracy dead? We see so much in America right now, and we need to make sure we protect the interests of our communities and our country. The fabric of this soil depends on the message that we'll be discussing in June. Thank you.
Have I skipped anything? We're only 10 minutes over. That's pretty good. This NABCO time. Keep it going.
I think we're good, Mr. President.
Stay safe, everybody. Stay safe. And if there are no further comments, the meeting is adjourned. Thank you. Love you,
Thanks
everybody.
everyone for letting me join in. It's great to see
Thank
you
you,
all.
Mary Jo.
Thank you all for being
Take
here.
care. See you.
Care, everyone.